Welcome to The Explainer. Today we are cracking the code on one of the most common, but let's be honest, kind of confusing medical tests out there, the complete blood count, or CBC. We're going to take that page full of numbers and turn it into a story that you can actually understand. You know that feeling, right? You get your lab results back, you look at the paper, and it's just a wall of abbreviations and numbers. It can feel like you need a decoder ring. Well, you're definitely not alone, and by the end of this, you're going to feel a whole lot more confident about what it all means. So here's our game plan. We'll start with what a CBC actually is. Then we'll meet the three main cells it's looking at. After that, we'll do a deep dive into each one, your red cells, your white cells, and your platelets. And finally, we'll see how it all comes together to paint a bigger picture of your health. Okay, so let's get right into it. What exactly is a complete blood count? Why do doctors order it so often? And what is it really telling them? The best way to think about it is as a snapshot of what's going on inside your blood and bone marrow at a single moment in time. It's like a fundamental checkup for your blood, and it acts as an incredible early warning system for a whole range of conditions, from something like anemia to infections and other disorders. All right, so let's meet the three absolute stars of the show, the core components that a CBC test is designed to analyze. Each one of these guys has a super important job to do to keep you up and running. First up, you've got your red blood cells, the RBCs. Think of these as the body's massive, tireless delivery fleet. Their whole job is to pick up oxygen from your lungs and transport it to literally every other cell in your body. Super important. Next are the white blood cells, or WBCs. This is your personal security detail, your immune system's army. They are the warriors that are constantly on patrol, fighting off bacteria, viruses, and any other invaders that aren't supposed to be there. And rounding out our top three, we have the platelets. These are the tiny first responders. They're like your body's emergency repair crew, rushing to the scene of any cut or injury to patch things up, form a clot, and stop bleeding. Okay, now that we've met the team, let's get into the details. We're going to start with that oxygen delivery service we talked about, the red blood cells, and look at the key numbers your doctor sees on the report. So on your report, you'll see these big three for red blood cells. The RBC count is pretty straightforward. It's the total number of red cells you have. Then there's hemoglobin, which is the really crucial protein inside each cell that actually grabs onto the oxygen. And finally, hematocrit, which tells you what percentage of your blood is made up of these red cells. All three together give a really clear picture of how well your body can move oxygen around. So what happens if these numbers are a little off? Well, they act like clues. If your levels are on the low side, it often points towards anemia, maybe from not enough iron or vitamin B12. But if they're too high, that could be something as simple as dehydration, or it could be a sign your body's working overtime to get oxygen, maybe because of a lung condition or even just from living at a high altitude. Right, and just when you think you've got it figured out, you see more abbreviations. You might be wondering, what on earth is an MCV? Well, the CBC doesn't just count the cells, it actually looks at their size and shape. And that gives us even more detailed clues. MCV is a perfect example. It literally just measures the average size of your red blood cells. And this is a huge clue for doctors. For instance, if your MCV is high, it means you have larger than normal cells, which might point to a vitamin B12 deficiency. If it's low, your cells are smaller, which is classic for iron deficiency anemia. See? It's like detective work. All right, oxygen transport, check. Now, let's move on to your body's defense department. It's time to take a closer look at the warriors of your immune system, the white blood cells. This one number right here, the total WBC count, is a really powerful first look at what your immune system is up to. Is it cruising along normally, or is it on high alert fighting something off? For most adults, that calm, normal range is somewhere between 4,000 and 11,000 cells per microliter. But here's where it gets even more interesting. A CBC with differential breaks that army down into its specific units. Think of neutrophils as your frontline infantry for bacterial infections. Lymphocytes are more like special ops for fighting viruses. And a sudden jump in eosinophils, that could signal an allergic reaction. Knowing which type of cell is elevated gives doctors a massive hint about what kind of battle is being fought. So if the total count is high, that's called leukocytosis, it often means your body is ramping up to fight a bacterial infection. On the flip side, if the count is low, or leukopenia, that could be a sign of a viral infection, an autoimmune issue, or even a side effect from something like chemotherapy. Okay, on to the last of our three main players, Let's talk about the tiny but absolutely mighty platelets, your body's internal repair crew that's always on standby to stop a bleed.
With platelets, there are two main things to look at. First is the platelet count. That's simply how many you have. And the other is the mean platelet volume, or MPV, which tells us their average size. You need to have enough of them, and they need to be the right size to do their job properly.
And this is all about balance. If you have too few platelets, which is called thrombocytopenia, you could be at a higher risk for bleeding. But if you have too many, or thrombocytosis, you could have a higher risk of forming dangerous blood clots. The count can give doctors clues about everything from infections like dengue fever to inflammatory conditions. Okay, so we've looked at all the individual puzzle pieces, the red cells, the white cells, and the platelets. Now, let's just step back for a second and see how they all fit together to give us that complete picture of our health. And this is maybe one of the most important things to understand. Your CBC results don't exist in a bubble. They're not just about spotting serious diseases. So many everyday things can nudge these numbers up or down. How hydrated you are, if you just had a tough workout, your stress levels, certain medications, all of these can cause temporary changes. Which brings us to this critical point from Medline Plus. An abnormal result does not automatically equal a diagnosis. It's not a final verdict. It's more like a flag, a signal that tells you and your doctor, hey, let's talk about this. It's the starting point of a conversation, not the end of one. So, by understanding what these numbers mean, you've turned a confusing piece of paper into a powerful tool for your own health. It lets you have a better, more informed conversation with your doctor. You've basically learned how to read the map of your own blood, and now you can use it to help navigate your health journey.